Senate Appropriations Health and Human Development Subcommittee come to order, and we are 3 minutes late, but we're pretty close. Yes, that'd be good. Thank you everybody for being here today. We really appreciate that, and hopefully, as the music says, we're going to keep things light because it is a little dark outside. So let's go ahead. Senator Jones, do you mind opening us up in prayer? Can I count on you for that? You're on number 10. Thank you.
Number 10. May bow our heads. Heavenly Father, thank you for the opportunity to come and share in the resources of this great state. Heavenly Father, bless the proceeding and bless those that are present here today so that we can lift up and glorify this meeting in your name and in your honor. And these blessings we ask in thy name. Amen.
Thank you. So, So the agenda, as you know, we're going to go with DBHDD first, Georgia Council on Developmental Disabilities, DCH, Georgia Board of Healthcare Workforce, Composite Board of Medical Examiners, Georgia Drugs and Narcotics, Office of Health Strategy and Coordination, DHS, Vocational Rehab, DPH, and Trauma Care Network folks are on their way from the airport. So we'll see if we're going to put them last if they're here, and Department of Veteran Services. And then we're going to have public testimony after that. Thank you for pinch hitting for Commissioner Tanner. Take your time getting set up. I'm not rushing you, but you're up. Okay, you're good. Thank you. Ms. Fielding is pinch hitting for Commissioner Tanner. He is out of the state, I understand, so we're good. Thank you.
I'll go ahead and get started just in the interest of time. Chairman Watson, first I just want to take the opportunity to thank you for allowing us to take a couple of minutes, good afternoon, to provide some context to the governor's budget proposal for FY 2024. That is what we were asked to do today, but since there is some movement on the House version of that document, we'll address a couple of changes that we know that they plan to make when they vote on it this afternoon. Again, as you mentioned, my name's Ashley Fielding. I am Assistant Commissioner for Agency Affairs at the Department of Behavioral Health and Developmental Disabilities. I am here on behalf of Commissioner Kevin Tanner, who regrettably could not be here today. I'm just going to address the statewide changes up front and not hit them in every program budget. For all of your information, I'm working from Section 15 of your budget document. In the state funds changes, and my slides are now up, so I'm just going to flip to those. The governor has acknowledged a need for additional investment in our state employee workforce. This, as you all know, is a critical need for DBHDD. We've talked quite a bit about the fact that DBHDD had a net loss of more than 1,200 employees in our hospital system specifically since 2020. This year, we finally have evidence that investments in salaries do have results for our state employee workforce, because after 30 straight months of net loss in headcount in our hospitals, we've had 9 straight months of net gains in our headcount. Now, what we know is that we're probably getting to the maximum potential of the investments we made in 2023, because while we still continue to see net gains in our employee headcount, we're starting to see that to slow. For example, we had a net gain of 1 employee just last month. But we know that this $2,000 additional investment will have a continued impact on both our morale, our retention, and our ability to recruit. Moving on to the Adult Developmental Disabilities Program budget. At line 60.5, you'll see a transfer of funds that go out of that program budget and into a newly created program budget that you all created back in 2023. And you'll see those funds show back up at line 61.1 in that special project program budget. At 60.7, you'll see the governor's recognition of a historic investment this body in particular made in 2023 for 513 now in comp waivers. We've not seen an investment like that before. And what the governor's doing here is just ensuring those individuals we enroll this year are able to continue to receive those services going forward. Then at 60.8, the governor has proposed adding 250 additional people to those now comp waiver roles. And so we can continue to bring people into those home and community-based services. I'll note two additions that we expect to see out of the House budget this afternoon. One is the House added another 175 waivers on top of the governor's proposal of 250. And what you'll also see when you look at that line item is a difference in the per waiver cost. Essentially, what that difference is an acknowledgement of the administrative overhead that is associated with enrolling people into the waiver programs. And then finally, in this program budget, the House has some directive language for the department to move forward with rate increases in our now in comp waiver services. This chamber in particular has been acutely aware of low wages in our home and community-based services programs, the workforce shortages that have resulted from that, and ultimately the lack of access to care that people have experienced as a result of those workforce shortages. As you all know, we have been engaged in a pretty comprehensive rate study for these services over the last several months. That's nearing completion. We just received about 500 comments during our public comment phase and are finalizing our cost estimates as a result. The House's language, as we understand it, acknowledges the fact that there's a pretty lengthy process that follows both state and federal approval. And they are just asking us to go ahead and move forward with that process. That would include additional conversation with the governor's office, approval by the DCH board to submit it to the Centers for Medicare and Medicaid Services, because ultimately this is an amendment to both the now and comp waivers. If all of those things move very quickly, we'd probably see approval, best case scenario, early next year. So what the House is asking us to do is go ahead and get moving. Okay, I will move on to adult mental health. If you see line 63.5 all the way through 63.8, this is essentially the governor's acknowledgement in the impact of the 988 implementation on the state's crisis continuum. There are a couple of you that I haven't had a chance to speak to directly at this point, so I'll take just a moment to ground people in what 988 is. It is the new number for both suicide, mental health, and substance use crisis across the country. It rolled out in July of 2022, and federal estimates indicate that once marketing begins, which is slated for later this fall, we'll see about a double in our demand on these services. So there are three categories of response that come from 988. First is answering the call. You all have invested quite a bit in that particular category of response, and the impact has been tremendous. We have gone from about a wait time of 200 seconds per call on average to less than 10 seconds per call. And we have been able to do that while also handling additional demand since the rollout of 988. So that's pretty significant. What the governor is asking you all to do is to affirm an investment in that second category of response. This is our mobile crisis response team dispatches. Essentially, in layman's terms, what this means is we've got a person on our crisis and access line, usually a clinician talking to somebody. 9 times out of 10, they're going to be able to, the call is the intervention. But if not, they are going to dispatch an individual to go, usually a licensed clinician, to go and assess the individual on the call, either in their home or just wherever they are, and see whether or not A, they can de-escalate the crisis, or they can assess them for the right level of care, whether that be outpatient services later on if they're able to de-escalate the crisis, a voluntary admission to short-term crisis stabilization, or in very rare cases, involuntary hold for evaluation. We commonly refer to that as a 1013. We've seen about a 40% increase in demand for these particular dispatches since even before 988 rolled out. And we, like I said, anticipate that demand to double once marketing begins. And we will also have, with the rollout of 988, new standards for response. These clinicians will have to respond within 60 minutes by 2025. And so what the governor has requested in this $63.3 million budget item is that you help us meet the demand that we see today and prepare to meet the new standards we will have to meet in 2025. In 63.6, 63.7, and 63.8, the governor is really calling for an investment in that third category of response. And we call that a safe place to go for crisis care. So 63.6 is just a continuation of the investment that you all made in 2023 for additional bed capacity in Augusta. That's the Serenity Community Service Board. 63.7 is the creation of a brand new behavioral crisis center in Fulton County. Despite the fact that Fulton County is our most populated county in the state, we do not actually have a BHCC there, and so this is an investment in that. One important thing to note is because Fulton County doesn't have a crisis center, we have on any given day in 2022 about 25 residents from Fulton County in a crisis bed in another county of the state or in a private psychiatric bed that we're paying quite a bit more for. And a BHCC, the model is 24 beds and 16 temporary observation chairs. So we could almost eliminate the impact of Fulton County residents' crisis on other counties, and also just make sure people are getting served closer to their homes, closer where they can be connected to their own primary care providers. And then at 63.8, this is a proposal to convert an older model of facility called a crisis stabilization unit to a behavioral health crisis center. Let me just take a moment to tell you what the difference between a crisis stabilization unit and a BHCC is. When you upgrade that to a BHCC, you add additional bed capacity. They have 24 beds, as I mentioned earlier. You add the opportunity for diversion with temporary observation chairs. Not everybody who walks into a BHCC might necessarily need 5 to 7 days of stabilization services, so this recognizes that need. And then it also allows walk-in access for the public and 24-hour drop-off by law enforcement, who we all know come into contact with people who are experiencing a mental health crisis or substance use crisis on a daily basis. One other important note just about the location here. Since 988 rolled out in July, the majority of our calls, if you weight the calls by population by county, are coming from rural areas, and particularly South Georgia. So this will help relieve demand in an area where we're seeing it most. And I want to note 2 ads that are coming from the House that we expect here. One is the funding amounts for the crisis centers are higher in the House version of the budget. What they are doing is recognizing that there is a new model for care in our crisis centers that's coming as a result of 988. The ultimate goal here is that we both provide continuity of care, ensuring that person gets a good connection to outpatient services so that we reduce the number of times they come to our crisis stores for help. And then it is also just improving the quality of care. Now, one other is there's an addition that you all should be familiar with. In the amended budget, you all approved a rate increase for our state contracted beds. The House version of the budget just recognizes that in their 24 version. And moving on to departmental administration, at line 68.4, the governor's just recognizing that there were funds appropriated that were associated with a specific piece of legislation last year that did not pass. So he is asking for those to be removed. And then in 69.3 at direct care and support services, the governor has requested that you all fund $2 million for capital maintenance and repairs at our hospital system. For those of you who aren't completely familiar with our hospital system, we have 5 state hospital campuses, and they are not 5 buildings. They are about 240 buildings that span 850 acres. At the youngest, if anybody's ever seen one, the buildings are decades old. If you've been to Central State, we're talking more than a century in some places. So we have quite a few needs for investment in those areas. What you don't see in your tracking sheet is that Governor Kemp has asked us to work with the Georgia Building Authority to conduct an in-depth study of what those maintenance needs are going to be on an annual basis going forward, so that we can have a better cost estimate of what this should be on an annual basis to really maintain these buildings to the right quality. But in the meantime, he's asking for a $2 million investment just to meet our most immediate needs. And then finally, I just want to touch on one house ad that we know will be coming over to you all later today, and that is just a bond for a treatment mall to be built at our hospital campus in Augusta. We had some discussion about this in the amended. The bond amount in the House version of the budget is about $3.3 million. We've built these facilities in all of our hospitals except for the Augusta campus, and they're about an $8 million investment. And if you don't know what a treatment mall is, it is exactly what the word says. It is the place where people who are in our hospitals go for their therapy, their physical fitness, the classes that they need to take to begin to prepare to live independently in the community. So these are really important to our environment of care, and just we appreciate your thoughtful consideration of those requests. At this time, Chairman Watson, I will take any questions that you all have, or I will happily sit down if you would like.
Okay. Do we have any questions from the committee? Sedora?
Thank you for your presentation. Yeah, I was very pleased to see that the Behavioral Health Crisis Center in Fulton is moving along, and I would just share with the committee, $15 million has been put in by Fulton County government to underwrite this effort and make it a partnership.
That's correct.
Great,
Thank
you. 12, Senator Kirkpatrick.
On the facilities that you're talking about, the
Yes, ma'am.
BHCCs, are all of those going, all 3 of those going through the CSBs?
Yes, ma'am.
Okay.
I see no further questions. Thank you, Ms. Fielding. Appreciate you
Thank you, Chairman.
pinch hitting for Commissioner Tanner. And so Georgia Council on Developmental Disabilities is next, and then DCH. And I may have mentioned this earlier, but we are doing public testimony. We did have the sign-up sheet there, and we're going to go through the agency, and then we're going to do the public testimony after that. Okay.
Yes.
Yeah, we did, yeah. If you have more to sign up, we have sign-up sheet here. Just raise your hand. We can, all right. I told you we're going to, we'll have our presentation and then we'll put it back down. Thank you.
Okay, very good. Thank you, Mr. Chair. And thank you to all of you for giving me the time to speak with you today. My name is Darcy Robb. I am the Executive Director of the Georgia Council on Developmental Disabilities, and it is my pleasure to speak with you today about our budget for fiscal year 2024. Okay. So at GCDD, our mission is to bring about social and policy changes that promote opportunities for the wide group of people with developmental disabilities and their families to live, learn, work, play, and worship in their communities. We are a federally funded organization. We are administratively attached to DBHDD, and we are governed by a council of members. And of our members, over 60% must be either individuals with developmental disabilities or their family members. Now you can see here our budget, which you will find near the top of page 12 of your document. Now, as you would expect from a federally funded organization, the bulk of our funds there are federal. However, we do receive state funds, and the bulk of those funds that we do receive from the state are for inclusive post-secondary education, or as it is better known, IPSE. So I want to thank you all for your ongoing support of IPSE, most recently for the additional $100,000 that you all saw fit to put into the amended fiscal 23 budget. That will be used for, of course, one-time funding for environmental and technological adaptations for the schools. But back to the big budget. As per legislative intent, and we did go through budgets back to 2008 to verify this, just under $41,000 of our state appropriation is for GCDD operations. Again, the vast majority, to be exact, $537.125 is for IPSE. So, what is inclusive post-secondary education? I know many, and perhaps even all of you, are familiar with inclusive post-secondary, but just as a touch base, IPSE gives students with intellectual and developmental disabilities the chance to attend college with their peers, and this is college essentially. Peers may or may not have a disability. So in thinking about IPSE, I want y'all to know that students attend typical catalog college classes with their peers. Now, as needed, they will receive modified assignments and they will receive outside of class support from IPSE program staff. Yes, I know some senators know it quite well. They also have internships because preparing for employment is a critical part of IPSE. They participate in campus social life. We've had students in Greek life, marching band, really the whole 9 yards. We're very proud to say that IPSE changes lives, particularly the lives of the young people who attend and their families. And one of the most tangible ways we can point to that is our employment outcomes. You can see here this chart shows you for the past 3 school years and the current one, you can see the total number of IPSE students across Georgia, number of graduates. Graduates, of course, is smaller than students because the programs are longer than a year. And then there at the end, you can see the percentage of graduates employed within 90 days. We think that that is particularly something to be proud of because if you look at Georgians with comparable disabilities, I'm going to try something. I'm going to hit a button, see if it comes up. There we go. So if you look at people with comparable disabilities who do not get a chance to attend one of these programs, the comparable employment rate is 15%. So we're looking at 58% employed within 3 months of completing a program, which I would venture to say is going to get higher the longer they come out from graduation, versus 15%. We're very proud of that, and we're proud of the programs for achieving that, and most of all the students. We have 9 programs currently in Georgia. I will not read them to you, but you can see them there on this slide. $425,000 of the funds that go to us go directly through us to the schools as well as the GAPESEC consortium that supports them all. The money per school ranges. Our 2 largest in terms of student body receive roughly $77,000 and $76,000 respectively. Smallest receives just over $20,000. And this is based on a funding formula that takes into account both the number of students attending as well as the length of program. Something we also accommodate in the formula is schools that do not yet have students, but that essentially are starting up. We have learned that is, you really cannot get it off the ground without some sort of seed money, essentially. And so we accommodate for that in the formula as well when we have new programs that want to come online. Funds that do not go directly towards the programs do compensate our staff member who manages all things IPSE. And in the spirit of transparency, I do want to share with you that for the first time this year, we have enough that we are using 3.4% of these funds towards our administrative and fiscal staff. Now, this is not a significant, certainly not a major part of their jobs, but as the programs have grown, it does take up a greater percentage of their time in terms of supporting the programs by creating contracts, processing reports, managing the payments, making sure everything is tied up on the fiscal and administrative end. So, this year we are ready to go big on IPSI, and we are asking for an additional $500,000 for IPSI programs. Now, first and foremost, this would allow for additional support to schools, and that is both the existing programs and growing capacity and also bringing new programs online. This would also allow us to bring a second IPSI staff on board who would focus on data outreach, data tracking for alumni as well as outreach. We were very pleased. We learned yesterday morning that the House has included an additional $200,000. We really appreciate that support. And something I want to share with you that is true now and will be true should you see fit to give us a budget increase. We are always very happy to share with you our formula. We are very happy to share with you where these dollars go. But we will say that over the years of our funding, we have learned that having some flexibility and fluidity is a real benefit. So we would respectfully request that language attached to any additional funds you should see fit to grant, that it be IPSC specific, but also allow for flexibility from year to year because the needs, particularly of the schools, do change. We did make the same request of the House, and we appreciate that budget language, which we saw for the first time, of course, yesterday, it does allow that flexibility. So in closing, we believe that the case is strong, that IPSI is an excellent investment for not only to the disability community, but for our state. And so we ask for your support this year with additional funds, and we thank you for the support over the years. That is it for my presentation. Again, I thank you so much for this opportunity, and I'm happy to answer any questions.
Thank you so much. Any questions from the committee? Seeing none, so thank you for your presentation.
Thank you.
Alrighty. And moving on to maybe a smaller portion of our budget, DCH, so we'll what's that? Yeah, so for our committee, it's page 13 of our document.
I appreciate that, sir. Good afternoon, Mr. Chairman, committee members. Kaylee Noggle, Commissioner in the Georgia Department of Community Health. We are section 17 in your tracking document. It might be easiest if you want to refer to the slides that we've handed out. We have talked about most of the governor's recommendations at one point or another in a number of committee meetings. Most of those changes are related to lots of movement in our FMAP, or our federal cost share, this year throughout the program. So I have included what we anticipate will be the final House changes in these slides as well, and can speak to some of those and highlight a few of those for you today as well as soon as we get slides up. As a reminder, going into FY24, our FMAP base is 65.89%, so that's the percentage of Medicaid that federal government will fund, the state funds the rest. Beginning in April, our extra 6.2% FMAP that's been in place during the COVID-19 pandemic or the federal public health emergency starts to go down. So beginning in April, that goes down to 5%, and then in July, it goes down to 2.5%, and so on continues to phase out over the course of FY24. So much of what you'll see in the governor's budget recommendations is those movement of funds from state and federal funds balancing out those changes. Just a refresher on our budget, $18 billion base in FY23, mostly federal funds, $4 billion in state funds, and you can see we've just highlighted how that's split between our programs. And Department Administration, we're so grateful for the support from the governor and for your support as well over the past year or so with cost of living adjustments for our employees. And I'll echo what others have said, that we think that's starting to make a difference. One change from the House to these changes is just a true up in our statewide billings for TeamWorks. The other changes are largely either a reduction in one-time funds or disregards from, a disregard from last year that needs to come out of the base budget. Note there are no changes to the Board of Dentistry. They just have statewide changes as well as the State Board of Pharmacy. But there are a number of items in healthcare access and improvement, or the State Office of Rural Health. And I'll just highlight a few of them. Beyond the statewide changes recommended by the governor, what we'll see from the House is a reduction of $3 million in the Rural Hospital Stabilization Fund. A couple of years ago, it stood at about $9 or $10 million. There was a reduction of, I think, $2 million last year and a further reduction of $3 million this year that would leave $4 million in that stabilization program, really as a recognition of what we've talked about so much this year, which are the directed payment programs that are coming online that should go a long way to support our hospitals around rural Georgia. Every year, we generally see some funds added to support federally qualified health centers, FQHCs. So there's a couple line items in here where we're removing one-time funds that were added last year to support startup, and then adding some additional funds to support the startup of 3 new FQHCs in FY24. From 90.6, which actually isn't in your tracking sheet, but we've taken some liberties with what we believe the tracking numbers will be. But if you're following along on our slides, the remainder of the items on this page are really specific asks from facilities around the state that really go to support either increased patient volume at charity care clinics or increases or renovations in programs that are supporting graduate medical education and residency slots around the state for Colquitt Regional to create a simulation lab and support there. St. Francis Hospital, which we talked about in the amended budget, who's developing out increasing residency space, and Archibald Medical as well. In healthcare facility regulation, in addition to the governor's statewide change, the House will recommend $250,000 to support the implementation of House Bill 1069, which is the new licensure category for residential mental health programs. This same add was in the amended budget, so this annualizes it into FY24. There are no changes in the Indigent Care Trust Fund. And then moving into our big Medicaid programs, the first one being aged, blind, and disabled. I'll call out a couple items for you. The governor had recommended $79 million based on growth in this program. The House has reverted that to a $32 million reduction to that budget. There's a lot of FMAP changes in and out and annual true-ups that you'll see. I will draw your attention to 93.8, which is what will amount to rate reimbursement increases for our nursing homes. That's a move to the 2021 cost reports. There was a significant jump in those cost reports and rates last year, with instructions to continue moving to the current year cost reports annually thereafter. That's $82 million using existing funds. And then the bottom items that we've highlighted are, again, what we will anticipate coming over from the House, starting with an increase of $1.3 million to provide adult coverage of dental services. Currently, dental services are provided to Medicaid members under the EPSDT program, or Early Periodic Diagnosis Screening, where we provide services needed to any child. But this will increase or make those dental services available to adults as well. A 5% rate increase for EMS providers, a 2% rate increase for home and community-based service providers, $5.2 million, a 5% rate increase for in-home nursing care providers that provide services to our medically fragile children in our GAP program, an increase in the dispensing fee of just under $1 for pharmacies that have low volume, so under 65,000 scripts per year. Increase to the 2022 Medicare rate for speech language pathology, audiology, physical therapy, and occupational therapy providers. That is the amount you see there, $2.1 million, is half of what it would cost to get to the 2022 Medicare rate. And then the last item here is a yes item, and something that we've worked a lot on, both with the House and with Chairman Tillery and his team over the last couple of years, and that's rates related to the psychiatric residential treatment facilities. We have worked on cost reports with all of those facilities over the last year. Generally, that's how we have paid those. We're currently paying 100% of cost plus 5% based off of that. This actually introduces a new model where we would seek CMS approval to tie the PRTF reimbursement rates to up to 75% of the current Medicare inpatient facility rate. Back in the envelope math on this today, I think this would equate to about $620 per day for those facilities. Those rates right now range from anywhere from high 300s, 407, up to the highest rate being $597 a day for facilities that treat children with a co-occurring diagnosis of autism. We anticipate the state funds impact in this program to make that move, if approved by CMS, would be about $440,000. And the Medicaid low-income program, again, a number of changes related to FMAP, in and out, and changes from that rate decreasing over the next year. And then you see a number of the similar items coming over from the House of dental service coverage and the EMS rate increase. There is $871,000 to reimburse family psychological and therapy services, rates for, I believe, 5 new codes to be provided there. Increase funds to remove the 5-year waiting period for pregnant women and children who are lawful permanent residents. This is something that we discussed last year. It ultimately didn't make it across the finish line, but it's back, recommended again by the House. This would require just a state plan amendment, not a waiver. The same dispensing fee increase of just about $1 for low-volume pharmacies. Again, the same similar change to the speech language pathology, audiology, physical therapy, and occupational therapy providers. Again, this represents half of what it would cost to get to the 2022 Medicare rate. $18.7 million is being recommended to increase select primary care and OBGYN codes and increase those to the 2021 Medicare level. And again, there's a yes item at the end that essentially sets the floor for CMOs or care management organizations related to durable medical equipment so that the fee-for-service reimbursement rate is really the floor in those instances. In Peach Care, just in addition to the FMAP changes recommended by the governor. There's, again, the 5% increase for EMS providers. And then in the state health benefit plan, we've talked about the changes to the both certified school employees, state employee, and non-certified school employees, both in the amended budget and carried into FY24. At what you'll see recommended by the House, we talked about it in the amended budget, but it's recommended really finalized in language, a yes item by the House here, which is to phase in that increase to the school system for the non-certified school employees. As a reminder, that rate is changing from $945 per member per month. We need to get closer to $1,580 to preserve the solvency of the plan, but this will phase in that increase over 3 years. So just a $250 increase in the first year, an additional $250 in the second, and then moving up to the difference of $1,580 or whatever it needs to be in that third year to maintain the plan solvency. And then intent language at the bottom that suggests that the department should make an annual recommendation and adjust both employee and employer rates to maintain solvency of the state health benefit plan going forward. It's pretty quick, Chairman, but I'm happy to take any questions on both the governor's items or the House.
Absolutely. Senator Hickman.
Yes, ma'am. Thank you for being here. 2 questions. First of all, seem like we have got in our community, and I'm sure it's whether it be Vidalia or where it's at, Savannah, we are just loaded down with these medical transport people, and they're either in old ambulances or they're in minivans, and sometimes they got people in them, sometimes they don't have people in them. Is there an efficiency in I just don't understand the reimbursement or why are they, seem like every time you see there's another one out there. That's my first question.
So normal EMS services are regulated through the Department of Public Health, and they award those contracts by zones across the state. DCH contracts for non-emergency medical transport, so you could be seeing a little bit of those mixed in.
Yeah, non-emergency.
We award those based on regions of the state as well, but they do use subcontractors. So they are held to certain standards of timeliness that they will then subcontract with other providers locally in order to try to maintain those standards. That service is currently in procurement to make sure that we get a new round of vendors that can ensure that they can meet our standards. We've had some challenges there over the years, and we're hopeful that we can improve.
That's what I was thinking. Some of them don't look like they're very capable of carrying anybody sometimes. Is it a rate per mile, or is it a rate per trip, or how are they paid?
I think sometimes it depends on the distance that they travel. There's a first couple of miles, I think, that are one rate, and then it goes beyond that. But that's something that we're going to look at in the next, as we do these next contracts. There is a difference, I think, for us in whether or not that's a transport in a metro area in a very short distance versus folks that are traveling longer distances to service members in the rural area.
Okay. The next question is, and I may have misunderstood this, but we've heard a lot about the increase in the health insurance, and you mentioned about that it go up to the $1,580. It was going to be phased in over 3 years?
So for state employees, the state funds the employer share. For both state employees and certified school employees, that the funds related to the employer share are added into the budget of either state agencies or in the QBE formula for school systems. For non-certified school employees, that the state does not provide that funding, and local school systems are responsible for funding that. So that is the portion that will be phased in over 3 years.
So, Mr. Chairman, Appropriations Chairman. Can I jump over that one? Can I jump over it? Is it legal to jump across?
You know, Senator, you can do anything you want to do.
Am I confused about this? Because it looks like when we see a lot of this budget stuff, they're going from 900 something to 1,500 immediate jump. Is this different from what we're talking about here?
No, sir. It's what you're looking at is are you talking about what we did in the amended versus now?
Yes, sir. Yes,
Okay.
sir.
So I think what the commissioner is telling you is that there's a hole in our state health benefit plan. We're looking at filling that hole. To fill that hole immediately would be to take all state employees, the employer portion, to 1,580. Is that right? 1,580?
Right.
The House's proposal was to do that slower for non-certified employees because those are funded solely by the local system.
Oh.
And when they're certified employees, it's an 80-20 cost share on teachers and certified employees.
Okay.
So by taking it and staggering it in $250 a year, starting first in April 1 or January 1 of 2024 per member per month, and then doing that again in January 1, 2025 with an additional $250, so you could kind of make that slow roll onto the local systems.
Okay.
That's why we allocated $50 million in the amended to help plug the hole that we knew we were creating by not moving to 1,580 immediately.
Okay. Thank you.
Thank you for the
Thank
assist,
you.
sir.
Thank you.
You're good. Any other questions? All right, Senator Warren.
Thank you. Thank you, Mr. Chairman. Thank you for your leadership and your being with us today. On the 90.7 on page 6, the Mercy Care Atlanta, just for the members' edification, that is is supported by an order of nuns and delivers health care to underserved, very, very poor population. And it's in the shadow of AMC, the AMC hospital, Wellstar Hospital, that closed on Boulevard, and they've experienced a real, they picked up immediately their patient load, presenting there who could no longer go to the facilities at Atlanta Medical Center. So I would, I know they need twice that amount in order to open up their fourth hub for services to the patient load, but the patient load is going through the roof. Thank you.
Thank you.
Thank you, Senator. Any other questions? Cindy, were you reaching for it? No. You did. It didn't show up. Okay. Chairman of Judiciary.
I just had a question a little bit more generic. So you said, I think the last speaker said as well, the House basically funded half what your asks were. Is there any place the House put all the money in?
There are, well, so to clarify, most of what you've seen here for those facilities were not department asks. Those were House ads that we're going through. Some of the rate increases were fully funded. I think the primary, and we'll double check, but I think the OBGYN and primary and dental rate increases were fully funded.
Okay. All right. Thank you.
You're welcome.
All right. I don't see any more questions. Thank you, Commissioner Noggle.
Thank you.
Appreciate it. All right. Got a late arriving question.
I'm so sorry. The money for the wind down, the Medicaid wind down, is that? Can you direct us to
unwinding,
what that is?
yes.
Unwinding. Thank
Okay.
you.
So there's no recommended additional money for the Department of Community Health related to Medicaid unwinding. There is significant money, and I suspect Commissioner Brose is here and may speak to that in her budget,
That's right.
but her staff, that's
That would
really
be
where the
what
money
that
needs
is.
to get to.
Yeah, thank you,
Yes,
ma'am.
absolutely.
Thank you.
Thank you.
All righty. Georgia Board of Healthcare Workforce. This is page 22 in our document, and All right. Mr. Basine.
Good afternoon. Thank you for having us here this afternoon. I'm Chet Basine, the Executive Director for the Georgia Board of Healthcare Workforce. I've had the pleasure of meeting many of you, and for those who I haven't, I look forward to meeting with you soon. To my left is Ms. Sharon Wilson. She is actually new to our board. She's here as part of meet and greet, and she joins us after a number of years with DCH in the IT department and made the transition over to our finance and budget manager. So thank you. I'm here today to present the governor's recommendations for our budget. I do understand there were some questions. I will attempt to weave in the replies to that through our budget overview. First, in section 97, our budget, these are, the first one is statewide, 97.1. This is the $2,000 cost of living adjustment per the governor's recommendations that we are very grateful for, that will assist with staff retention and happiness. Section 97.2 is the $180,000. I believe that was one of the questions that came in. This is for the physicians for rural areas. I'll touch upon that program since there's a funding recommendation in there, but we will likely need some additional staff to process these. There's contracting, there's applications, there's also the finance and budgetary component of submitting. So this will require additional resources. At the same time, we are underway in attempting to digitize as much as we can within the purview of the DCH IT infrastructure that so far seems to be very robust. So I'm grateful for that. So that is section 97. The next section is our graduate medical education. That'd be in section 98. What you'll see is the adjustment for the FMAP, 98.1. On 98.2, that is for 102 new residency slots. I will just make a brief mention that the budget that came out of the House, the number there is for 116 residency slots. That number, what I do is I stay in touch with all the programs that are attempting to increase residencies, and just in the past few weeks, even though with constant pinging, the numbers do change, and we do get them over to everybody as soon as possible. So you'll see 116 on the House's side, and thus the dollar amount increasing for that. And then last but not least is the 98.3, the $375,000, and that's for to do additional feasibility studies for more graduate medical education. As we're all well aware, there's a big physician shortage in the state, and by putting these grants with areas that have the potential to succeed with GME, we should be able to have more physicians practicing. The next section is 99. That is for the Mercer School of Medicine. Only change is part of their 7-year program. They're the $663,114, and that's for their Columbus, Georgia campus ramp up. Section 100, there are no changes. That is the Morehouse School of Medicine grant, so we'll go over that. Here in section 101, what you will see is a series of recommendations from the governor. First is 101.1. This is for behavioral health professionals, and what this is going to be part of, I believe it's an HB 520 right now from the House. This is the HB 1013 update or follow-up, however you want to word it. But in there calls for us to, the Healthcare Workforce Board, to administer some funds for behavioral health. And that's not just at the physician level, but that would, the way we understand it, go down the spectrum of clinicians, counselors, social workers, psychologists, kind of be a more comprehensive approach. So that's what 101.1 is. 101.2, that is actually the GBI has some vacancies they're attempting to fulfill. Part of that package is they are going to be offering loan repayment. We would just be administering the program for the individuals they recruit into those positions. And there would be no application that we would put out. The GBI would inform us that we've hired this individual, and then we would administer the contract for the loan repayment component, since that's something we are very familiar with. 101.3, I believe there was a question on that as well in advance. That's an increase of $2,040,000. So physicians for rural areas is on the physician component. We do administer loans for dentists, nurse practitioners, and physician assistants. But for the physician component, what the early thoughts we have are with perhaps a modification is our current way is a physician can apply. It's an annual application. They can earn it up to 4 times with an annual application. It's $25,000 of loan repayment if they're in a county of 50,000 or less. What we would envision probably doing is something to the effect of making the commitment longer, so it's not just an annual commitment, perhaps greater dollar amount for that physician who earns it, but it would probably stair step up. So meaning year one's award would be lesser than, say, year 3 or 4, depending on the duration that comes out of it. So it really financially motivates that physician to stay in that community, if you know what I mean. And then last but not least, $101.4 dollars for advanced practice providers, both the PA and the nurse practitioner level. We're very grateful for that. We actually just did the application review and awarded loan repayments to both of these advanced practice providers, and especially in the nurse practitioner program, we had far more applicants than we'd had funds. So this will be coming in at a very handy time, should it formalize. The next program is 102. That's undergraduate medical education. Here, this is another one in another program that we believe would be good for nursing. This is nursing faculty. So these are nursing faculty who are in the space, shall we say, and the loan repayment here would incentivize them to stay as nursing instructors, because with the nursing shortage going on right now, a lot of nurses have said we can make more money in a clinical setting than we can in an educational capacity. So we believe this will help retain some folks in there, and maybe in the long term even recruit some folks into nursing education, which is very needed and a very, very challenging job. Here's the summary of all the different programs, and as you review it, you'll see the program. Then the next column is the current FY23 budget. And then the next one is the governor's recommendations. In the final column, you'll see the governor's FY24. And as you review that, the final question that was given to me in advance for me to touch upon was the implementation of the data set from HB 1013. We are in process with that. There are a few different groups at that. The Georgia Composite Medical Board and the Georgia Board of Pharmacy within DCH. They've been both extremely pleasant and very good to work with. Both those boards are on one software platform, so we have been in communication with that vendor. The IT build, shall we say, has commenced. It took us a while to get the questions kind of finalized, to get some feedback, to get things standardized, and that development has begun. And then the boards that were listed in the in HB 1013 that were in the SOS side of the house. SOS prior to HB 1013 had engaged in a new software vendor to manage their licensing. They were going from actually the same vendor that Medical Composite Board and Board of Pharmacy worked with, which was known as System Automation, to Salesforce Solutions. So they have us on their list. What we're hearing is once they're fully done with their transformation with their software A to software B, then they will be working on our HB 1013 data needs. From a cost perspective, that's still TBD. What they've told us, there's a change order involved, and once it's available, they'll let me know. With that, I appreciate your time here this afternoon, and I'm available for any questions that the committee might have.
Thank you, Mr. Bassine. Any questions at all? Seeing none, thank you for the presentation. Appreciate it.
Thank you.
The follow-up. Next is Georgia Composite Medical Board, which is right by the podium already. And page 26 of our tracking sheet.
Hi, well, good afternoon, Chairman Watson, members of the committee. My name is Daniel Dorsey. I'm the Executive Director of the Georgia Composite Medical Board. With me is Mr. Kenneth Morrow, our Director of Investigations. Just a little brief overview of our mission. We exist to protect patients in the state of Georgia, and we do that through licensing and enforcement. Just a breakdown of our board, 16 members, you got 13 physicians, 2 consumers, 1 PA, got a staff of about 30, which includes 6 post-certified agents that are actively investigating. From a licensure count, we have about 60,000 licensees in the state that are under our purview, and it's broken down there. Predominantly, about 2/3 of them are physicians. Initial application volume and it was around 6,900 last fiscal year. We renewed 26,000 licenses, and then there's about a 5-year time span there, just so you can see what our initial application volume has been. From a complaints perspective, FY22, we had about a little over 2,000 complaints, and it's broken down there as far as what the allegations were for those complaints. The appropriated budget in FY23 was a little over $2.6 million, which all of it goes to salary and fringe for our staff. During FY22, the board collected about $7.5 million in licensing, renewal, and enforcement fees, which were turned over to the state's general fund. The board does keep, it has retained revenue for administrative fees. That's if we do like a license verification to another state board or the APRN protocol reviews. We do keep those funds, and that's what that's what we use as far as our operating budget, and that's a little over $1 million in FY22. As far as the budget recommendations, there is it's 103 is the section there, and it's 103.1 is a statewide change. That is the $2,000 cost of living adjustment, and that's about a little over $78,000. And then 103.2 reflects an adjustment in merit system assessment, and that's it looks like $60. So in total, it's a little over 78. The House did make some adjustments. I want to say it was around $314,000 for personnel services, just to for the initial application volume to help address that. As far as a recap of 2022, data collection under House Bill 1013, we've been working with the Healthcare Workforce Board that you just heard a little bit about that. We revised some of our policies on electronic receipt of application documents to try to streamline things a little bit. We also have, we're now providing electronic copies of licenses, just as a way to streamline that to the licensees. And then there's also the education and training for physicians under House Bill 458. We have finalized that implementation as far as the physicians that are required for sexual misconduct and professional boundaries training, and so we are we've got that. We've implemented that. Outlook for 2023, we're now publishing quarterly newsletters to make sure our licensees are informed with what's going on at our board. We are again finalizing the implementation of House Bill 1013. Our APRN protocol agreement, that we are looking to digitize that and put that in an electronic form with our online account system. That will greatly reduce processing time for those APRN protocols, and we're really excited. We're working with our software vendor on that. And then last thing is we are moving to Twin Towers, if probably in the next couple of months, still to be determined. But if there's any questions, Mr. Chairman, I'm happy to answer.
Questions for Senator Kirkpatrick?
Yeah, I was just looking at your graph about the investigator caseload, and it looks like the disciplinary actions have gone up, but I couldn't tell from what you said if the number of investigators has gone up.
We did have some vacancies that were created by some investigators that left for other opportunities and had some turnover, and so it took a little while to get those holes plugged and getting individuals onboarded. But our investigative staff is we now have 6 investigators and an investigations director. So we're working to reduce the investigator caseload. I think in FY22 it was 79. We've brought it down to around 60-something now, give or take. 65. So, yeah.
Thank you.
So,
Thank you. Any other questions? All right. Okay.
Thanks for being with us today. What, are you going to experience any savings in coming over Twin Towers?
we're administratively attached to DCH. I'm sure they may know more about the move and the cost savings. So I can follow up and try to get that for you. Okay.
Yeah, 2 Peachtrees was sold to the city, right?
Exactly.
And they're moving, I think, in April or somewhere in that time frame.
Yeah,
And
that's right.
working remotely has made that easier to do. So thank you. Any other questions? Or I'm sorry, Senator Tiller, Chairman.
Thank you, Mr. Chairman. Thank you for your presentation. I got 2 questions for you.
Yes, sir.
One is, as you see the new licensees, you're able to bring in initial applications. Are you seeing anything interesting in the data? Are they older folks moving here? The younger folks getting licensed? Are they coming from one particular place or the other? Or?
The increase?
Yeah.
I think it's attributed to 3 things. One, there's been a great investment in medical education over the years, so that could be increasing that. State's population is increasing, so that is just bringing more physicians in. But then also, we're in the Interstate Medical Licensure Compact, and we are the 6th busiest jurisdiction in that compact. So a lot of people are wanting to come here and get a license or use their Georgia license to go somewhere else. So.
And then one follow-up on that.
Sure, certainly.
From time to time, we'll get called, as we do on different agencies, about licensing and moving things. What's your average time frame to approve, from application to license approval?
It depends on the application, but the key thing is really just getting all those documents from the individual, and sometimes they can be coming from like a medical school or a residency program, and and we and the applicant don't really have control of that. But once we receive all the documents, it's usually and the application is complete. It's about a 1-week turnaround from when we can. And most of our applications, we can administratively approve it. It doesn't have to go to our full board for review. So that does reduce processing as well. If it's if it's a clean application, we can move it forward. Yeah.
Anybody else? Thank you. Thank you, Mr. Dorsey. Appreciate that. Georgia Drugs and Narcotic Agency is page 27. Okay. The next is Office of Health Strategy and Coordination. So, all right.
Good afternoon, Mr. Chairman and
Yes, sir.
members. Thank you for letting me come over and speak with you today. I am Dennis Trofton. I'm the director of the Georgia Drugs and Narcotics Agency. We are probably most known as the enforcement arm for the Georgia Board of Pharmacy. And so we do regulatory enforcement. We also do criminal enforcement of the 1613 code in the state of Georgia. And we also have a part in the licensing. We work with the board. We're not part of the board, but we work with them to, as part of their licensing process as well, to do background checks, et cetera, for the board. We are not looking for any enhancements to the budget this year, other than the governor's recommendation and the legislature's recommendations. But I was asked if we could give you an update on the funds that we were given last year, so which we greatly appreciated. We got 2 new agents. These are special agents, and unique about our agency is our special agents are pharmacists. They start as pharmacists. I'm a pharmacist, been one for 36 years. And deputy director here that's with me, pharmacist, as are all of our agents. And then they go to the post academy and become post-certified peace officers. So we have arrest power, same as deputies, et cetera, across the state. And so it's a unique, in fact, there are only, I believe, 2 or 3 other states in the country that do it the way we do it. But it's a unique group of people, and I think it provides a great deal of extra protection and enforcement for the citizens in the state as we go in. We not only do, again, the criminal, but we inspect every facility in the state that has prescription drugs in the facility, or we can. We have 9 agents, or had 9 agents until till we got 2 more last year, and we have filled those positions. One of those agents is currently in the academy. She's will be out in about 2 weeks, I believe. The other one, we just hired, and he started on March 3rd, and he will be attending the academy hopefully July 1st. So you increased my workforce by 20% roughly. And so thank you very much, because that's a lot of, for 10 people to cover, 11 agents to cover. It's quite a spread here in the state of Georgia. The other part of what the state provided for us was money for a database. Our agency, it sounds antiquated, and it is. We had no database specific for our agency that helped us to keep track, other than a database that was put together actually by one of my agents, who is much younger than me and has much more IT skills than I do, but they put together something that we can use, but it certainly was nothing to go into the future with. So we were provided funds last year, and where we are at this point, we have been in touch with 4 different vendors. We are attached to DCH for administrative purposes. So the total of 16 people in my agency, we do not have a procurement department, and we are not experts at large projects and procuring databases. DCH has been wonderful to work with us. They're providing us that guidance to do that. But we have identified part of those funds were to hire a person to run the database for us and oversee that. We have identified that our needs for that person. We have, with DCH, we have set up the position and are actively recruiting for that position right now for that. As far as literally told by DCH and going through the procurement process, and forgive me, I'm an old pharmacist and an old cop, that process and to get that system online could take from 6 to 12 months. So we are really just actively working through that with their guidance. But unique, as I mentioned, we do regulatory and criminal enforcement and licensing. There are a number of systems out there that do one of those at a time. Licensing, criminal, it's right. A lot of police officers in the state of Georgia and police departments, and they have their systems, and then regulatory enforcement, and we need to tie those together. So we are not going to jump at the first vendor that says we can do this for you, because we haven't had in the past. This is for the future. So so I greatly appreciate
Mr. Trump.
from last year.
Just for my education, so you're a pharmacist and post-certified, and your investigators are. Is that by statute, or is that by what you have always done traditionally, or?
That's by statute in 26.
Is that
the
right?
Pharmacy
Okay.
Practice Act. Yes,
I
sir.
mean, it sounds perfectly reasonable to be able to, if you're going to have arrest powers, then you should understand, what pharmacists do, and that's who you're regulating. So that sounds good. Any questions from the committee? I see none. Thank you very much. Appreciate that.
Thank y'all for the time.
Office of Health Strategy and Coordination and Department of Human Services is next.
I think we have a PowerPoint. Should be in the top right. Or, sorry, the net.
And
Top
just,
right over
I'm
one.
going to interrupt you just for a
Yeah.
second, Mr. Thomas. I know that we do have the public sign-up sheet, so as soon as the agency's finished, we'll pass that around again and get that. I know some people had wanted to sign up. So, thank you, Mr. Thomas. The floor is yours.
Good afternoon, Chairman Watson and members of the Senate Appropriations Health Subcommittee. Thank you for the invitation to be with you today and to present on the Office of Health Strategy and our FY24 budget. For those of you who are not familiar with myself and our office, my name is Grant Thomas, serve as Director of the Office of Health Strategy and Coordination. We are an office in the executive branch under the Governor's Office and administratively attached to the Governor's Office of Planning and Budget. Since some of you may not be as familiar with our office, wanted to provide a brief background on how we were established and our key objectives and goals and responsibilities. We were established through legislation that passed in 2019 in House Bill 186. That was a bill that had passed that session with a lot of different healthcare initiatives in it, and one was the creation of our office. And really the goal and what we know to be the legislature's intent of creating this office was to have an entity that could help, see the entire healthcare landscape in the state and help facilitate coordination and collaboration among the state's health agencies, as well as other agencies that might touch healthcare but may not, fall into the, traditional realm of healthcare. So we have the advantage to, seeing the entire healthcare landscape from provision of healthcare services as well as the healthcare policy in the state, and the primary functions of our office are to strengthen and support the healthcare infrastructure of the state and really help identify the top priorities for the governor and help ensure that the appropriate stakeholders, both public agencies as well as our external partners, are working together and brought to the table to work on these issues. House Bill 1013 that passed last year also assigned our office the additional responsibility of coordinating behavioral health services across state agencies and mental health policy across those state agencies. Governor Kemp appointed me to the position of director in the summer of 2021 after the office was funded for the first time in the FY 2022 budget. One note is, something to note is our success really depends on the ability that we have to work with other agencies collaboratively. So we've had some really great state partners. The four major health agencies: DCH, DPH, DHS, DBHCD, as well as other agencies like I mentioned that are not in the traditional healthcare space. And the Office of Commissioner of Insurance has been instrumental in helping us implement the governor's waiver programs, or the Georgia Access Waiver, and then DCH has been a great partner with the Pathways Waiver. So wanted to go over several different initiatives that we have been charged with, either primarily through legislation and through the budget. Implementation of the All-Payer Claims Database, or APCD for short. I'll go into that in more detail in the presentation. But also wanted to just highlight some of these other key areas. We went into more detail at Joint Appropriations on these items, but I'll go through them quickly. Review of the Medicaid managed care contracts and provided recommendations to DCH on those contracts. We did a national scan and looked at other state Medicaid programs, as well as evaluated our existing contracts and improvements that could be made with the upcoming procurement cycle. We also conducted, through a directive in House Bill 1013, a survey and study of transport of individuals to and from ERET facilities. We also, another directive in 1013 was the recommendation of a unified drug list for mental health and substance use prescriptions in both the Medicaid program and SHBP, and we provided those recommendations to DCH, and also a directive that was in last year's budget with a line item appropriation that directed us to take data that the state is already collecting from the nursing board, nursing workforce data that the state already collects, as well as data that hospitals submit to DCH through the annual financial survey and hospital questionnaire, and take that data and aggregate it and put it in a format that's consumable to the public. So working with the Georgia Data Analytics Center that's housed at the Governor's Office of Planning and Budget, we have, worked to create those public-facing dashboards so that, the public can see that information all in one place, and that it's not siloed and they're having to go to different surveys or different reports to extract that information, which is very time-consuming. So now getting more into the all-payer claims database, Senate Bill 482, which was sponsored by former Senator Dean Burke, passed in the 2020 legislative session. That legislation directed our office to implement the all-payer claims database, APCDs. 17 other states have implemented these. And really what an APCD is it serves as a centralized data repository where all healthcare payers in the state, public and private, will submit their health claims information to this database, and then we can take that data and then conduct use cases with that data. And it really provides a new level of insight and transparency into what we are paying for healthcare. A lot of those agreements of what insurers and payers have been paying to facilities in different areas of the state has been proprietary and confidential up until this point, but with the legislature's vision to have the state implement an APCD, we will for the first time be able to access that information. They will report the information to a secure environment in which we are able to, utilize that data and conduct use cases and show, what healthcare is costing, show utilization and how it varies geographically, and also conduct some specific use cases that I'll get into more in a moment. This is just an overview of the different entities working on establishing the APCD, our office, and then we're partnering with the Georgia Tech Research Institute that will help us with the analytics portion of those priority use cases. GTA is also assisting us. The Georgia Data Analytics Center is going to house the analytics environment for the APCD, and then we also have our data collection vendor on board who has established this environment in other states and is already setting up the environment to start taking in the claims data later this year. So this is an overview of the different entities that are required to submit commercial health plans with at least 1,000 covered lives, Medicaid and the state health benefit plan as well, and then there are certain exemptions and RISA plans are not required to submit. However, we have been working very collaboratively with the plans. We have several work groups that are meeting to help, with that process of claim submission. Many of these plans already submit claims in other states to APCD, so they're used to this. So we're hoping that many will do this voluntarily. These are the priority use cases that have been decided upon by the APCD Advisory Committee, which is established in statute, as well as our use case work group. And so really these are the priority areas that we will be focused on, at least initially, with analytics and use cases. I won't go through all those, but you can see them on the screen. And it's certainly not an exhaustive list. Long term, there will be many other use cases that will be submitted and that we will be working on. So just wanted to provide one quick example of how APCD data can be used. So the state of Virginia was able to address use APCD data to look at avoidable emergency department usage. And as you can see on the screen, they were able to identify that 14% of the 1.5 million emergency department visits in 2017 may have been potentially avoided had they been treated in lower cost settings. We know that emergency departments are oftentimes the most expensive place for care to be delivered. And so, as you can see on the right in that graphic, different services that were rendered at those facilities that could have been provided in a primary care setting or other setting that would not be as expensive. There was potentially be $100 million of savings, and more challenging to actually implement that than what you might see pulling the data. But I think that this is just the type of use case that can be deployed with APCD data and can be used to help inform policy decisions both by the state and payers and providers. So here's a timeline for implementation. We had a very aggressive timeline. We have our, the data collection environments being established. We have finalized the guide and the rules for data submissions. And then by June of this year, we will have all health and pharmacy plans having submitted by that deadline, dental plans by December 1st. And then we hope to have our first, intend to have our first analytic use cases available in January of next year, and then all payers, including all the others that are listed in statute, there's some agencies and others who weren't in the initial set of submissions, will be done. The database will be fully implemented by December of 2024. So here's a look at the APCD budget. This is where I wanted to draw your attention to in the FY24 budget. As seen on line 180.2 in the Appropriations Act, the governor has recommended that the $800,000 in base funding for the project be transferred from the Department of Community Health to our office. When the project was funding was first appropriated for the project, our office, was not in existence yet. I had not been appointed yet. The office hadn't been funded yet. So that money was put at the Department of Community Health so that some initial steps could be taken. But now that our office has been in operation for a year and a half, we are now able to directly oversee that funding. So they are the governor's budget is proposing to transfer that funding to our office. And given the substantial benefit to Medicaid that this program has, we'll be able, Medicaid will submit data to the APCD, and there will be use cases that can be conducted. It will better inform the state on how Medicaid dollars are being spent. The federal government is providing matching funds, 90% matching funds for the implementation phase of this project, so we're able to draw down federal money to help with implementation. And then this just provides an overview of what I've gone through before with the health initiatives that we've undertaken so far. So with that, happy to take any questions or
Any questions from the
comments.
committee? We have a couple. Senator Jones.
Thank you for the presentation.
Yes.
And then the data collection part and analytics, that's more backwards facing. How do you plan to use that data to make decisions going forward?
Yeah, so that's really where we go to those 12 priority use cases. So we'll ingest all the data into the database and have that in a secure environment. It will be de-identified, and then through our partnerships with the Georgia Tech Research Institute and the Georgia Data Analytics Center that will house the analytics environment, we will be able to, they have expertise in taking those raw sets of data and making them useful and conducting that analysis that is necessary to look at, how we can get better insight into utilization. One use case that I'll highlight is the surprise billing statute. So the surprise billing legislation that passed will use the median rate that is paid, or median rate that is calculated from services in the, based on the claims in the APCD to determine that median contracted rate that is paid out to providers for surprise bills. So there's really a lot of different uses that can be done, but it's through those partnerships that we have that that work will be done.
Thank you.
Senator Jones. I'm sorry, Senator Kirkpatrick.
Oh, I was just going to say that, in my opinion, there's nothing more important than linking our agencies and having a very big picture view of healthcare in Georgia. And you guys have really risen to the challenge, and I just want to compliment you and your staff, and also say that we request a lot of reports in statute, and I'm not sure we always get them, but if you're supposed to send us one, you send it by the deadline, maybe the day before,
Right.
but we get it. So
you.
thank you very much for that.
Thank you.
Thank you. Any other questions? No other questions. Thank you so much. Appreciate your presentation. And we're at Department of Human Services. That's page 29, our tracking document. And we're getting really a little tight on time. So if we could ask us to be brief, because I do want to have some public testimony too, and I'd like for them to get as much as possible. Thank you.
I'll keep my remarks really brief. I'll just focus on the governor's recommendations. So good afternoon, everyone. My name is Candace Brose, and I serve as the Commissioner of the Georgia Department of Human Services. So I will get right into it. We start using your tracking document on page 28, I believe, for Department of Human Services. And instead of going through each program budget where we have some of the common adjustments, I'll just highlight that you'll see the $2,000 cost of living adjustment for full-time benefit eligible state employees, increases for agency premiums, for insurance, changes for merit system assessments, increases in state funds for reduced FMAP and reduced enhanced FMAP, and adjustments for TeamWorks billing. So I'm not going to go through each of those in each program, but because they cover so many, just to flag those all in one fell swoop. So I'll go straight to page 30, child abuse and neglect prevention, line 190.4. The governor has recommended $184,926 to reflect fiscal year 2022 collections of marriage and divorce filing fees, and that's in accordance with House Bill 511 for dedicated fees from the 2021 session. On page 39, line 198.5, The governor has recommended $3,244,889 for 300 additional Medicaid eligibility caseworkers, and that is to ensure that our department can hire more staff leading up to the start of Medicaid unwinding, which is really just a few weeks away at this point in April, also called Medicaid redetermination. And that will certainly help us be ready to go. We've already made some hires. We're being incredibly aggressive, and we're also automating to the maximum extent possible so that we're not just relying on workforce to accomplish this work and reduce our error rates. There will be, just to highlight it again, I've mentioned it before, but that's roughly 2.7 million people in Georgia who have Medicaid right now that will need to have their eligibility checked when we start that process in April, and we have 14 months to do it. Moving to page 49, line 212.1, the governor recommended an increase of $89,613 to reflect collections in accordance with the Safe Harbor for Sexually Exploited Children Fund. And in the very next line, the governor included $3,375,000 for the rehabilitation of children, youth, and adult victims of trafficking. That commission is one on which I serve as chair, and we will be working closely with the First Lady to use these funds to further her objectives to reduce trafficking in the state. As we work through that, I think what we're going to be specifically targeting are those facilities that will house survivors of trafficking, trying to get more funds to those nonprofits to do their work. So in addition, based on some questions that we got from, I believe, Senate budget staff and from committee members to talk about the Safe Harbor Commission, in state fiscal year 2022, the commission received $351,005 in funding. In 2023, it was $110,586. To administer these funds, we work with CJCC to issue an annual grant solicitation, and we take applications from organizations who work with survivors of trafficking. We then work with CJCC to evaluate those requests, and then we determine at what amount we want to fund the applications that we receive. For example, in state fiscal year 2023, there were 4 grant recipients. 2 of those are facilities that actually provide housing, training, education to survivors. One of the recipients is the University of Georgia that actually has a clinic that helps survivors work through their paperwork to, get their record sealed, to get expungement for some of the crimes that they were charged with and convicted for while they were actually a victim of trafficking. So they do a lot of great work, and the 4th recipient was Wellspring Living. Again, it's another facility that has multiple locations to help survivors. Let's see. I can go through the House's recommendations if you would like me to do that, but otherwise that would be the extent of the governor's recommendations, and I could just open it to questions given the time.
Interest of time, we can meet later, or pleasure of the committee. Sounds like we'll meet later.
Okay.
So, sounds good.
Okay.
All righty. Senator Warren?
My timing was very bad, and I apologize. I was not here when you opened up with your remarks, but a seatmate said that you addressed the Medicaid unwind.
Yes, ma'am.
Because there was $8 million more added. And at whose request did you? Because you all were satisfied in our earlier hearing with the governor's allocation.
For some of the House additions, we're still working with the House to understand the full legislative intent and running through the numbers with them. But there was an add of almost $8 million to that specific program budget for FEBS. It would increase from the governor's recommendation of 300 new caseworkers to 450. And of course, we always value additional staff, but I would again say I think for the governor's recommendation, the 300 plus all of the automation that we've done, that's really going to be key, because in so many ways you can't necessarily hire your way out of a shortage. So we've been putting a lot of investments into technology and leveraging the flexibility that the federal government has afforded to us to do so.
So, do you have a sense of how you're going to spend those added house dollars?
If the Senate desires to keep the additional funds in our budget, then we would spend them on additional staff, new caseworkers, running eligibility.
And I know kind of a subset question that you had ended the bonuses at the
Yes,
end of the year, end of December, I believe. And is that because federal funds ran out, or you expended all the federal funds? Because the program continues, I think, through August of this next year.
Sure. So we had a certain amount of federally designated funds from some of the COVID packages that we could use to improve our systems or to benefit staff. What we did we obviously needed to make sure that our systems were prepared, and so we did a lot of investment using those funds for that. When we had the remainder, we decided to give those bonuses to staff, and we knew that they would eventually run out, but we didn't want to keep them away from staff just by virtue of the funds eventually running out. So that's what we did.
And just one final question is, have you all contemplated looking to the community-based programs that are rooted in communities to help work with this population as we go through this big transition? For example, the Southwest Georgia United Way has got a great leader and very integrated in the community. That's just one example. They're all over the state. Do y'all contemplate any sub-granting to help ease this transition, make it successful?
So part of what we've done is that we launched a statewide public relations campaign last summer, and we've done put together a lot of materials, ads, radio buys, TV, all of those things, materials that we can give to those organizations. We give them presentations on what's ahead to make sure that they have everything handy. We've solicited input from like GBPI, for example. So every time we get a request, we honor it, and that statewide public relations campaign has really been pivotal to make sure we're reaching all across the state with different groups. The important part of that, though, is that we had to come up with the state match to then be able to pull down the 90-10 federal funding, and it takes a long time to get those materials prepared, submitted, and approved by the federal government. So we absorbed that state match part so that we could pull those dollars down, and that's where we've actually then done the community outreach.
And that doesn't involve, at this point, sub-granting to build an organization's capacity to outreach the population. It's just sharing information with them at this point.
And it's been incredibly helpful doing that. We're getting great reception from our partners to make sure that they know how to communicate best with their stakeholders.
All right, thank you.
Thank you so much.
Thank you. Next is Georgia Vocational Rehab Agency, and then Department of Public Health. All right, Mr. Wells.
How's it going? I'll be fairly quick. Our budget is pretty much 2 lines, so I'll get straight to it.
All righty, that's quick.
Basically, we have one outside
We're on
of our
page 45 in our tracking sheet.
Yes, page 45. So I apologize. Essentially, outside of the statewide spreads, we have one reduction there for the Commission for the Deaf and Hard of Hearing, $20,000. That was pretty much a pass-through, so that doesn't impact us operationally, and that's pretty much the biggest bulk of our operating budget. We do have one request in our bonds, and so essentially we're making a request for $8 million for bonds, and so we've seen an uptick in the number of students that we're serving, and so we're trying to work to get a lot of our infrastructure on the Roosevelt Warm Springs campus back online. We currently spend about 20% of our budget serving individuals at that particular location. And so a picture is worth 1,000 words. Outside of Roosevelt Warm Springs, it should be Meriwether County. But the $8 million essentially stops water intrusion coming into the facilities. So for the last few years or so, we've seen where just water is getting into the various facilities. And so what the $8 million does is it goes in and does a waterproofing of the entire facility. And some of the rooms that are currently not being occupied, it allows us to get those facilities back online. So that's the bulk of our requests for the FY 2024 budget. I'd like to thank you for your time.
Thank you, Mr. Wells. Any questions? All righty. You caught us up there a little bit.
No
Thank
problem.
you so much. All
Thank
right,
you.
So we'll move on to Department of Public Health. Just right. Yeah. Anywhere you'd like to, Dr. Toomey. And we're on the 52, page 52.
And just very quickly through the governor's budget, as well as some select items in
You wouldn't mind getting that mic a
in
little
the
bit
house
closer?
in the house budget, if you so desire.
Okay.
We're just going to use our
Handout?
one of these slides. Yeah, if that's all right. Just very quickly, because you've heard much of this before, the statewide changes, as in all other agencies, including the $2,000 cost of living adjustments, so we're already seeing some dividends in our recruitment and retention. The one thing that's different about us is that we have Board of Health employees, and our Board of Health employees, although not state employees, are also getting this supplement. And so I just wanted to make sure that you're aware of that. So it goes to state as well as Board of Health employees. Under emergency preparedness and trauma system improvement, the ambulance equipment repair and fire service, that's in McIntosh County. In fact, it was one-time funds. We knew that, so this reduction was not unexpected. The ambulance is purchased, the fire truck is ready to go, and so we expected that reduction. I do want to say a few words about pre-exposure prophylaxis. That's the 259.2. This is the expansion of the pre-exposure prophylaxis or PrEP services. This was initially a pilot project. It was done in a number of districts, Rome and in Habersham as well. Initially, COVID happened, not much was done, but the funding was continued, and we were able to continue and expand those services. Now we're seeing that with these additional dollars that the governor has continued, we will be able to move into all the districts that don't already have existing PrEP services. We took a survey of districts, and we're able to identify those that started and those that didn't. And I'm skipping ahead to the House bill because I do want to mention that they gave us some enabling language to have a little more flexibility where we are going to put these. And the reason that's important is that Athens actually has developed their own plan, but I don't see Senator Davenport. But Clayton did not have. The health director at the time didn't respond to the survey. Now they do have a brand new health director, and he's quite good. And they would love to have a PrEP program, so we'll be able to work with them. And so we're going to be expanding to all these areas. It can use the money equitably to enhance PrEP throughout the state. And the last thing was the major maintenance renovations and repairs of the public health laboratory. This was bonds that would be used for these repairs. We got, as you may recall from the joint budget hearing, about a $28 million federal grant for the lab repairs and upgrades and expansion of our ability to do laboratory testing. But we can't use those federal funds for everything, including things like furniture and carpeting. These bonds will allow us to do that, and will serve as a state match. So this will really be helpful. And I know I promised Senator Kirkpatrick I'd be very fast, but I'd love to go very quickly in the House budget if you would allow me, or at least some key items. We talked about PrEP, I think, sufficiently, and how important it is, because PrEP is prevention of HIV infection. PrEP coupled with identification of new HIV cases and linkage to care is the only way we're going to end HIV in Georgia. And we in the South, in general, have among the highest rates of HIV. And too few people are on PrEP, and so we really see this as an important key component. So we're very excited about that. A couple of House additions include additions for the Sickle Cell Foundation, including a mobile van and some additional funds for recruitment and retention, $363,675, $500,000 for a pregnancy and parenting grant program, and the Georgia Council of Lupus Education and Awareness, and this is some money, $50,000 for education awareness and other activities. There's a pass-through the Georgia Coordinating Center, which is located at Grady. They said that to right-size their budget, that the appropriate budget would be $2,300,000, so that's what that reduction is. Georgia Poison Center is getting an additional $250,000. I do have to note that we have 3 contracts with the Poison Center, several federal funded, including COVID dollars as well as other CDC dollars. This particular one is mostly state dollars and was started in the 1990s by me when I was a state epidemiologist, believe it or not. And so that has grown largely to do rabies control and rabies follow-up and post-exposure prophylaxis for rabies and animal bites and other bites besides dogs and wild animal rabies. So it's kind of interesting factoid. But I did want to just talk about this very quickly, and that's the pilot program for home visiting. This came to fruition really at a children's cabinet meeting before Christmas. We had a children's cabinet where we all convened and all the agencies were talking, as well as advocates who were at that meeting, about what can we do. COVID is over, but we recognize we have a lot of issues in the child health arena, in the maternal health arena. How can we work more effectively to address these issues? And out of that came some discussions about how home visiting done in a novel, innovative way, in a more comprehensive way, where we actually worked across the entire pregnancy, not just after problems began, but proactively, and particularly as we got public health clinics in those rural areas more engaged in some of this outreach. How could we make that happen and work together more effectively? And I'll be the first to say that public health has been siloed, even within its child health programs, but we were siloed as agencies. And this pilot program, I think you may have the one-page document describing it, really represents the work of discussions with all the other commissioners who deal with children's health, maternal health, as well as Commissioner Jacobs in DECAL, to talk about how we can work together and use our respective agencies' influence to lever more effective interventions before problems occur. And we had a working group that also crossed all the agencies, and out of that came this initial pilot. You'll notice that several of the pilot areas include Senator Tillery's, Chairman Tillery's district, as well as Senator Hickman's. That was not deliberate, that was strategic, only because it represented areas, as well as Bo Hatchett's, by the way, Senator Hatchett's, because of high rates of maternal or infant problems. So we're trying to address both maternal as well as low birth weight, some of the other challenges we are facing. And so this, I think, represents a really creative and unusual approach that I don't know of any other state taking, as we combine various agencies influences funding and the potential to access reimbursement through other mechanisms to work together across community lines. One of the key messages here is that, you know, nurses will be working from the health departments, but we're looking to use community health workers to do a lot of that outreach. Community health workers come from the community and they are trusted members of the community. And we potentially can identify women when they're pregnant, initially in the first pregnancy test. We have worked with Commissioner Brose to get DFACS workers in our health departments so that women can be directed to all the services that they're eligible for, including Medicaid, immediately before they leave, and get into care right away. And then start that process, particularly for those highest risks or those who may have had poor outcomes in the past. And so I think I'm talking fast because I know I don't have much time, but I'm also talking fast because of my excitement, because I've worked in public health, as you know, for many, many years. And I have never seen this kind of coordinated approach that I think has an extraordinary potential to see some really good outcomes and improvements in all of our programs working across the board. And I'll be happy to answer any questions. And there's also, of course, the Babies Can't Wait reimbursement rate increase, which we're happy to see because that ties right in to the home visitation, because often these infants, when they're identified, need that referral to Babies Can't Wait. And we've had a hard time recruiting providers and ensuring that they get the reimbursement they need and having an adequate number of providers.
Thank you, Dr. Toomey. Appreciate that. Any questions from the committee? No questions. You've answered everything thoroughly. We sure appreciate that.
No, I just talked
Thank you.
real fast. Didn't give you a chance to ask questions. No, thanks so much. I appreciate it.
All right. Department of Veterans Services. And did the Georgia Trauma Care Network Commission made it? Okay. Well, I'm sorry. You'll be next. All right, we're on page 61 of our tracking document.
Well, and I don't know that I will beat the time for GVRA, but I will certainly try. I'm Trish Ross. I'm the Commissioner of Georgia Department of Veterans Service. And we are line 365 in the governor's budget, and I'm also going to touch on, as everybody else did, the House recommendation that's coming across today. Is it up there? I can talk real quick. The majority of our budget, of course, are the additions based on the state adjustments. Yeah, if you could, please. And so under departmental administration, no changes from the governor's recommendation. And then under our Veterans Memorial Cemetery, our only request, which was put into the House budget, was that when we snapshotted our positions for the $2,000 increase, that did not account for our people we had already hired. It was done at a different point in time, so that's an additional 3 people that we have on staff so that they could get that increase. For our Georgia War Veterans Nursing Home, there are no changes to the governor's recommendation. And then if we run to Veterans Benefit, which is the majority of our personnel, again, based on the point in time where they took the snapshot on our manpower, we're requesting the funding for the $2,000 salary increase for 6 additional positions that are now filled. And so the House recommendation is coming across with those adjustments that totals less than $40,000 from the governor's recommendation. And pending your questions, that concludes my presentation.
Any questions at all? Thank you so much. That was very much appreciated.
Thank you.
So we've got a handout here, Georgia Trauma Care Networks coming to the committee, and we're on page 60, I think, if that's correct.
Afternoon.
Good afternoon.
Liz Atkins, for those I don't know, I serve as Executive Director for the Georgia Trauma Care Network Commission. I'm a trauma nurse by background, so I will wrap it up, and I'm accustomed to always being last. So in terms of our budget, really the only changes, as you know from the 2021 session, the Trauma Trust was established. So now we get sort of still kind of a super speeder true up based on whatever the predictions were for the year before. So that's where the 807 reduction comes from. But then on the back end, we get our secondary funding mechanism, which is the fireworks excise tax. So that's the 1.4 million. And you have in front of you a one-pager. Again, I know you look at PowerPoints all during these meetings. So our budget distribution really never changes. The only thing that I'll really leave you with that I do anticipate will be different, because this is not yet fully approved by the commission. They wait for you to go through your process first. Is that we have more of a sight line than ever before about what rural trauma looks like, because we've had a number of big consults. We had the American College of Surgeons here for 5 days last month, and they looked at everything top to bottom and met with rural stakeholders both in South Georgia and North Georgia. I do anticipate a shift in funding from the bigger level 1 and 2 centers to the 3 and 4 now that we kind of understand better what that readiness cost proposition looks like, and then hopefully we can recruit more centers into the system. Very proud that Northeast Georgia became a level 1 trauma center recently, so a huge win for our system there.
Thank you very much, Ms. Atkins. So we have, how many level 1s now do we have? So Grady, Northeast Georgia.
You think I would know that off the top of my head, but
okay.
Yeah, so we're obviously down the one from Grady, Northeast Georgia, Macon, Savannah. Don't let me forget one, because they'll be texting me
Kennesaw.
tomorrow. And they're level 2.
Okay.
But some of the, besides Northeast Georgia, yes, another one is pursuing level 1. The major difference is really the academic commitment to research. Clinically, pretty much
Gotcha.
identical.
Okay.
Yes. Mm-hmm.
Thank you so much.
Thank you.
Appreciate it. All right, so I think that concludes we're going to hand out the public testimony portion, and if anybody else would like to sign up. I know that a lot of us have other committees to go to at 4, so I certainly understand, but we're going to try to give everybody yes, Susan Boland Butts is first, and why don't we take that? Yeah. Why don't we take that to the back of the room and let Miss Boland Butts go ahead, and so we won't be talking in front of. Won't be talking in front of her. If we could hold it to a couple of minutes, and if anybody wants to waive their public testimony for others, we'll see what we can do. Okay.
Thank you so much.
Okay.
I'll do my best.
And we'll be happy to take everybody's comments also if they're written, but otherwise we could hold it to a couple of minutes. Thank you.
Okay. I'm representing the Service Providers Association for Developmental Disabilities, which is the statewide trade association advocating for community providers who offer a variety of services to persons with intellectual and developmental disabilities. I'm setting aside my prepared comments because you understand from Assistant Commissioner's comments that a rate study was conducted by the Department of Behavioral Health and Developmental Disabilities. And while that preliminarily has been shared with providers, we have given public comment, we don't know where DBHDD will land with its recommended rates to DCH and CMS. And that makes it difficult for us to, as a provider association, have a specific ask today. However, our provider network is in serious crisis, and I would be remiss if I didn't at least take an opportunity to share very quickly with you what that looks like. And based on our preliminary review of the rates that have been shared, we have some concerns. The first of those really has to do with the assumed wage rates for direct support professionals and for support coordinators. The rate study that has been shared assumes an hourly pay rate of $15.18 for direct support professionals. And in comparison, DOAS, the state's own in-house experts, have indicated that for non-clinical direct care staff on the state hospital payroll, the starting pay is $19.25. we don't really understand why there would be such a significant difference between the two. We believe that the minimum needs to be set at $18.86, which is the 75th percentile shown in the rate study, instead of the 50th percentile, which has been represented by the $15.18 hourly rate. Absent a meaningful investment in wages, this severe workforce shortage that we're all experiencing is going to continue. A couple of pieces of statistics. The national turnover rate for direct support professionals is 44%. Georgia's at 43.4%. It's not anything we really are proud of. We've had providers that have closed, discharged individuals, and declined to accept new individuals because of this shortage. The support coordinator position is a position that is a case manager responsible for not only quality service provision, but the maintenance of health and safety to individuals. The rate study suggests a wage there of $19 per hour. This position requires a bachelor's degree. Similar state positions are starting at $24 an hour, and we strongly suggest that the final rates be at least that.
We appreciate that, Ms. Butts. Thank you so much, and we'll, if you have anything written, we'll be happy to take that. Thank you. All right, next, who do we have next on our list? It's okay. Katina Atmore, and then Ian Pierre is on target. Okay. Thank you. We can.
Okay. Good afternoon, everyone, and thank you for this opportunity to say a few words. I definitely want to say thank you to the House for recognizing the need that citizen advocacy has, and to say thank you to you for your consideration for our request of $200,000 to restore, strengthen, and grow citizen advocacy in Georgia. This line item is listed under GAO, the Georgia Advocacy. So briefly, and I'll be very quick, close personal relationships are the ultimate safety net for each of us, where we can count on support when we cannot stand up for ourselves, to make ourselves heard. Citizen advocacy recognizes that while persons living with developmental disabilities often face huge hurdles in their lives, they are less likely than most of our neighbors to have such relationships. Citizen advocacy is a community movement of citizens committed to a relationship between a person with a disability and a person without a disability. It is between valued, competent, and resourceful individual citizens and individuals who are socially devalued in our culture, usually because of a physical or mental impairment. Through a circle of trust, citizen advocacy coordinators invite volunteer citizen advocates who have compassion and backbone, common sense, passion and persistence, connection to the community, and the ability to see through another person's eyes. Chatham Savannah likes to say that it's someone who's standing on thick ice, standing beside someone who's standing on thin ice. That is the beloved community, and I was just recently reminded of the beloved community at an event at the Isle of Hope, where 400 people of advocates, proteges, board members, and community members, the mayor of Savannah, and Senator Mallow attended. Closing, for over 45 years, thousands of citizens have responded to the call of becoming representative payees, protectors of legal rights, a friend, a mentor, a monitor. Advocates have reunited families, shared their home, found suitable and safe housing, secured employment, and helped access good health care, and much more.
We certainly appreciate that. Thank you so much. We'll be happy to. We appreciate your handout. That's very good, and you're welcome. Yvonne Pierre, Miles Henderson, apologize for names. Here we go. All righty.
Good afternoon, and thank you so much for this opportunity to speak. I'm a virgin to the mic, so bear with me. Thank you for this. My name is Yvonne Pierre. I serve as committee member for Black Family Connection with the Down Syndrome Association of Atlanta. I'm also a parent of a 21-year-old who has Down syndrome. And I was trying to prepare something to talk about the now comp waiver and all that stuff, but I really want to talk about the root cause or the root issue that I see from my experience in the disabled community, and that's the lack of value. They're devalued, and also the lack of urgency for what they need to to unlock the waiting list. There's over 8,000 people in Georgia who are on this waiting list, and there's no urgency. And I derive from that because when I had my son Zion, and I'm gonna make it real quick, when I had my son Zion, the geneticist told me when he presented the information that he's sorry, and that next time I get pregnant, that they have technology now to abort. It's grounds for abortion to have a child with a disability, or specifically with Down syndrome. So the value of his life, starting from an embryo, was not seen. So whether it's education, whether it's healthcare, whatever the issues are, we have to change the perception of how we see people with disabilities. And until the perception change, nothing will change. Thank you.
Thank you. We appreciate that. All right, all right, who's next? Ms. Henderson, Nancy Petra after that. Yes. You can, whenever you're ready.
Good afternoon, community member. My name is Miles Henderson, and I live in Chapman, Georgia. Thank you for allowing me to talk with you today. I'm here to advocate for the Unlock 2.0 campaign and contribution for families and people with disability. I am here to ask this community to support 200,400 new now come a waiver in the FY 2024 DBAGD budget. We know that is a lot of new waiver, so please have enough to make the total 1,000 for 2024. There are 7,000 people waiting for help to be able to live their life with dignity and contributing to the community. That a lot of people asking for help. I am also here for advocating for an increase to the hourly rate of pay to $18.86 per hour for direct and support staff. The people that work every day alongside people with disability. Direct and support staff help people with disability to become more independent. They care for their needs, teaching them skills, and take them out into the community
Thank
in
you,
a important job.
Mr. Henderson, I really
that
appreciate
teach them more a job that matter in this world. Please increase their pay to the rate in the IDD rate study report by DBHDD. And I'm here to advocate for a waiver because it means I have something to looking forward to every day when I wake up in the morning. It means I won't be.
Mr. Henderson, we got this, and I really appreciate you helping us out here. We got your written testimony. We thank you so much for being here. We really appreciate it. Thank you. Nancy Petra, Alzheimer's Association.
Thank you. I'll be brief. Nancy Petra, I'm the Director of Government Affairs for the Alzheimer's Association Georgia chapter. We are really excited that the House included our $1 million funding to support Alzheimer's and other related dementia caregivers in the DHS budget. And so I'm just here to ask for your favorable consideration to keep that money in the budget, and I'll be happy to provide any supporting documentation in writing. Thank you.
Thank you so much. Tace Kaiser, and then Larry Howe is next.
Good afternoon. My name is Thais Kaiser. I'm here with Unlock 2.0. Unlock 2.0. I'm one of the parents. I'm also a mother of a 21-year-old disabled son. My son Isaiah, he has autism and a mental intellectual disability. My son Isaiah also struggles with a mental illness. My son struggles with daily living skills. He can't dress himself correctly. He puts things on backwards. He doesn't understand time, money. He reads at kindergarten level, and he needs simple things, help pouring milk. And this will be an ongoing help. He will need it for the rest of his life. For a long time now, I have been trying to get my son the now and comp waiver. I am one of the parents that's trying to get on the list. There's many of us. I've applied 4 times, and I have been denied. I am due to go to court. So there's already 7,000 people on the waiting list. In addition to the people like myself, the ones that can afford to fight this fight. So I ask that, I know it's a big ask, that so far I'm aware that there's only 375 spots available, that we get as close to 1,000 possible so we can service people like this gentleman and hopefully people like my son. My second topic today is to ask for an increase on the pay for people that work with this community.
Really appreciate that, Ms. Kaiser. Thank you so much for being here. Larry Howe.
Larry Ho. I live in Tyrone, Georgia. I want to thank you for allowing me to speak on behalf of my family and 1,000 families like mine. And I'm here to ask the committee to add the now comp waiver to make that total of 1,000 for 2024. I'm advocating this based on my personal experience. I have a 25-year-old son with Down syndrome. He has been on the waiting list for 12 years and counting, and that's almost half of his life. And his we've experienced the difficulty since 2019 after he aged out from high school. And after high school, he has nowhere to go. He had no peer to interact with. He stayed in his room almost all day long, playing with the iPad. And his mood become very moody and rebellious, and sometimes even violent. And my wife is a realtor. She has to go out a lot of time. And because my son cannot be home alone, so at that point, I have no other choice. I have to retire. This is about 6 or 7 years earlier than I had hoped. And had we had the waiver, and my son will have a much better, much more meaningful life. And we would be able to send him to daycare to engage in more meaningful activity and learn a lot more useful skills. That would also allow me to continue to work, to contribute to society with my skill and experience. So I'm telling this personal story not to win your sympathy. I want to show that because there is not enough waiver, people with disability suffers, their families suffer, and ultimately the society suffers. So please support at least 1,000 new now-come waiver in the budget for 2024. So you have the power to change the life of thousands of people, and you have the power to make Georgia.
We appreciate that. Thank you so much for being here. Who's next? John Zoller, and then Charlie Miller, and Zan Thornton. John Zoller here? John, let's go to Charlie Miller. Can you get up? Come on up to us.
I can, yes, sir.
And then Zan Thornton. Charlie, you want to come to Mike right here? Would be great. All righty.
Thank you, committee chair and members of this committee. I want to go ahead and warn you, I was called and won the other day because I always have something extra to add. So I apologize if I go over it, and please cut my mic. Not right now, at least. Not right now. I won't have any offense, don't worry. So I will keep it very brief.
Right.
My name is Charlie Miller. I am the Legislative Advocacy Director at the Georgia Council on Developmental Disabilities. As y'all all are very, very aware, hearing testimony today, we have a 7,000 person waiting list for services in the disability community. I would like to say that that's approximately 226,000 caregiving families that are not able to go to work, that are not able to pay taxes within our communities. And having having more waivers and more services will allow more people with disabilities to go to work, be in the community. And Georgia's physical effort compared to the southeast regions is lower than most states in our region, and only 61% of the national average. One other thing I want to just say is that GCDD supports the 1886 for direct support professionals.
Okay. Thank you, Charlie. Appreciate it.
Thank you, and I have these if that's okay.
Okay. All right. Zan Thornton, and then Darian Todd, then Quindarian Boykin.
Hi, my name is Zan Thornton. I'm a disabled Cherokee veteran, and I've had kids with developmental disabilities as well. I'm here to say it's been 33 years since the Americans with Disability Act was passed. It's 24 years since the Olmstead decision was passed. It is time to end the wait list. We are tired of waiting. I'm with Georgia Adapt. We've been here since 1988, and we support 1,200 waivers on the list plus a livable wage. Thank you so much.
Thank you. Appreciate that, Ms. Thornton. Darian Todd, and then Quindarian Boykin, and then Cindy Levi.
Thanks for having me here. So I'll just make this quick as I can. So hello, my name is Darian Todd. I work at Georgia State University as a community advocate specialist. I am a graduate of Kennesaw State University's IPSE program. The reason why I'm here today is to let you know that you should continue to fund IPSE programs because it really gives the students a way to learn very important life skills that they wouldn't have learned if they wouldn't go to an IPSE program in Georgia. It also helps the student really figure out who they want to be and what jobs they see for themselves. And after their program, they get set up with people that can help them get a job that they see that they want for themselves. And I just think that you can continue to fund them because they're a very crucial part of our Georgians here in Georgia because it helps them with their educational future in the past. Thank you.
Thank you, Mr. Todd.
You're welcome.
Quindarian Boykin, Cindy Levi, and then Deborah Stokes.
Good afternoon. My name is Quindarian Boykin, and I am a freshman at Georgia State University with the ITO program. I want to tell you about my first year of college. At first, I felt like college was not going to be easy for me at first. I was worried. I wanted to get the help I needed with classes. I was nervous that I was going to fail. With that idea, I got the help I needed. I passed all my classes. I have a 3.05 GPA, and I have friends, and I am involved in concert band and marching band. I have professors that help me with assignments and are helping me improve my skills in tenor and also saxophone. In the future, I want to be a professional saxophone player. My family loves music, I love music, and I love entertaining people. Instead of making music, I want to play music. I always wanted to go to college. My mom and I started to talk about it when I was in 10th grade. And look at me now, I'm 19 and in college. Working towards my goals, playing music for others, I am more confident, and I have a lot of friends, and I feel like I am a leader again. Right now, I'm representing the idea in Georgia State University at the Capitol. I'm so glad that I have this opportunity to be supported. Everyone needs support sometimes. Students with disabilities deserve to go to college, and kids supported too. Without the support of programs like this, young people with disabilities may not reach their goals and may be lost in life.
Mr. Borkin, thank you so much for being here. We really appreciate your story, and good luck at Georgia State. Cindy Levi and Deborah Stokes and Elizabeth Apley.
Afternoon. Thank you, Chairman Watson and committee members. I'm Cindy Levi, CEO of Avita Community Partners, one of your community service boards here in the state of Georgia, serving the 13 counties of Northeast Georgia. Today I come to you to speak in favor of the expansion of behavioral health crisis centers, as was presented earlier. My organization had the opportunity to construct a behavioral health crisis center, which opened last year in July, and we have seen the positive impact on our community with offering 24/7 access to crisis services. I also speak in support of the increased number of now and comp waivers. However, I do have to ask that you pay close attention to the behavioral health rate study, which we are still awaiting any kind of information regarding that, but also the IDD rate study. I do serve on an advisory committee for the IDD rate study and have expressed these concerns. So if we do have an addition of now and comp waivers, that's awesome, but we need to have the workforce in order to be able to serve those individuals. So I do speak in favor of the at least $18.86 per hour wage rate for direct support professionals, and also ask that none of the services have rate reductions. As it is presented currently in community access, 4 of the 8 rates are reductions to what we're currently paid. Thank you for the opportunity.
Thank you. Appreciate you being here again. Elizabeth Apley and Chris Johnson. All right, Deborah Stokes.
Mr. Chairman, members of the committee, my name is Elizabeth Apley. I'm here on behalf of Georgia Supportive Housing Association, Georgia Advancing Communities Together, Enterprise Community Partners, and Presbyterians for Better Georgia. We're advocating for increased funding to the Georgia Housing Voucher Program, which is a program the state created pursuant to the settlement agreement with the Department of Justice some 12 years ago. And that agreement included the obligation to provide supportive housing to the target population of 9,000 homeless people with severe and persistent mental illness who are cycling through the criminal justice system, the state hospitals, and emergency rooms. So we are housing these people, but we're housing them in the most expensive and least effective way possible. Under the settlement agreement, we created the Georgia Housing Voucher Program. We are now serving about 1,900 people of this 9,000 person population. This program is highly effective. It's nationally recognized. We did cut the budget by 24%, by $6.4 million at the outset of the pandemic. We're grateful for your support in restoring some $3.4 million to that program last year. The House has recommended an increase of $1.9 million, and we're urging you to increase it to $10 million to increase the number of people who we are serving in this highly effective program, to increase the size of the voucher in order to address this very tight housing market that we're in now, to provide a landlord incentive of reimbursement for 1 or 2 months of rent when the units are held open while the tenant is being vetted and small improvements are being made, to also ensure that all of these...
Thank you, Ms. Apley. I really appreciate that. Deborah Stokes, I had skipped over her last time. I'm sorry. And then Chris Johnson and Jessica Corbett.
I'm Deborah Stokes, Executive Director of the Georgia Council on Aging, and this will be brief because most of you are familiar with COAGE, the Coalition of Advocates for Georgia's Elderly, and our perennial ask for additional funding for non-Medicaid home and community-based services. We know that keeping our elders at home gives them longer lifespans, and it helps save money for the state as well because long-term care is very expensive. So we're asking for our $10 million for home and community-based services. Thank you.
Thank you. Appreciate that. Chris Johnson and Jessica Corbett.
Hi, good afternoon. I'm Chris Johnson with the Georgia Mental Health Consumer Network. Please forgive my voice. It's been a long week. I am here to, thank you for letting me be here. The budget contains line item 15.5.14, and I wanted to make sure you all understand that's not new funding. That is a restoration of funding from the COVID cuts. The temporary funding that we had to get us through the pandemic was federal dollars, and those are gone. So we are just trying to get back to where we were in 2019.
Okay. Thank you. Appreciate that so much. Jessica Corbett. And then Amy Locicero.
Good afternoon, Mr. Chairman and members. Just wanted to come. I'm Jessica Corbett. I'm the Director of External Affairs for Fulton County Government, and just want to say thank you in advance. Many of the members here we've already spoken with about the Fulton County Behavioral Health Crisis Center project. That funding did increase in the House budget and now reflects about half a year of what DBHDD recommended. That aligns with our construction schedule and will meet our needs. So just want to say thank you in advance for supporting that request now that it's in the Senate. And again, if any of you are welcome to come out and visit that facility. Before I leave, as a parent of a child with autism, I just want to also acknowledge all the other advocates who are here and thank them for their voices. Thank you.
Thank you so much. We appreciate that. Amy Locicero.
Amy Locicero.
Locicero.
Hi, and thank you for staying and listening to all of our public comments. I know it's been a long day for you all, and some of you have been in a lot of other committee meetings. I'm a physical therapist, and I'm a provider in the CIS and Babies Can't Wait program. I'm here today to ask you to support the ask from APTA of Georgia, the Speech and Hearing Association and Occupational Therapy Associations asked to put money in the budget to increase our rates to the Medicare rate at right now. The House, and we are very appreciative of what the House has given us, but that's only half of what is needed to get there. So we're asking that if you could find the other half in your budget somewhere to get us to that full amount, we would greatly appreciate it. I think you heard today from DCH and DPH how much it's needed.
Thank you so much.
Thank you.
Appreciate that. Polly McKinney and then Tom Bauer. Okay, thank you so much. And Tom, I think we got yours in writing too, but you're welcome to say 30 seconds up there.
Okay, thank you, Mr. Chairman. I'm Tom Bauer with the Occupational Therapy Association. I want to thank Senator Kirkpatrick and working with me and Senator Alberts and Harrell on this issue that occupational therapy assistants and PT assistants are not covered by Medicaid, even though they are in the CIS program, even though they are covered in the school systems. All of our neighboring states cover them. Because of their help with requesting DCH, Senator Harrell had a meeting with DCH last week, and out of that came the idea of asking for a language amendment to allow reimbursement within existing resources, and we would just like put that on your radar screen. It came out of the meeting after the House got too far into their budget process, and I just wanted to mention it since it was not what came over. It won't be coming over from the House. Thank you very much.
Appreciate it. Mr. Bauer? All right, that concludes our meeting, and thank you all very much.